Hi, this is Professor Tom Marwick. I'm the Director at Menzies and a cardiologist at the Royal Hobart. Heart failure is a modern epidemic. There are 30,000 new diagnoses of heart failure each year in Australia and about 500 of them in Tasmania. One of many problems with this illness is needing to come back to the hospital after you've been discharged. 30% within a month and 50% within 3 months. There are things you can do to decrease the chance of coming back to hospital. First, take your medicines and stay on the medicines and keep in touch with your medical team. Second, daily weights are important. Third, salt restriction is essential. Fourth, fluid control is important for some people, but one fluid you shouldn't be taking is alcohol. Fifth, smokers need to quit. Sixth, physical activity remains important in heart failure. And finally, if you have increasing shortness of breath or problems with swelling, be in touch with your local doctor. If this turns into a crisis, you may need to call an ambulance to come back. In the next few minutes, we'll give you some more information about these 7 points. Pay close attention. We have a questionnaire at the end.
Every morning when you wake up, empty your bladder and weigh yourself. Keep a record of your weight so that your medical team can monitor it. While you are there, remember to take your prescribed medications. Weigh yourself daily in the morning after you empty your bladder. Take your prescribed medications daily. If you gain or lose more than 2 kilograms in 2 days, contact your medical team. Hey Belinda, check this out. Assault with a deadly weapon.
You've got to be joking. But I realise you do have some important messages about salt in food.
Well, I do for my heart failure patients. They have no idea how much salt can impact on their health.
So I can't order fish and chips today?
Well, maybe not, because it's got so much salt in it. And we recommend not drinking any alcohol.
I think in that case we better just order coffee.
Take the salt shaker off the dinner table. Read the ingredients on food packages and avoid salty products. Avoid alcohol.
Lena, can you just go and grab me some water from the tap down there, please?
For people with heart failure, it is important to control your daily fluid intake as prescribed by your health practitioner. Not everyone needs fluid restriction, but check with your medical team to see if this is appropriate for you. Be aware that water included in foods such as ice cream and fruit is included in the water allowance. Extra fluid can cause shortness of breath and swelling, putting extra stress on the heart.
And don't gorge on water.
Do you come down here much, Belinda?
I come down 2 or 3 times a week. It's the mixture of fitness, it's fun,
Social.
it's friendship, it's the whole lot. Yeah, it's great.
Absolutely. For people with heart failure, it is important to stay active every day.
Okay, no, Micah. I actually...
Clearly, not everyone's talented, but we can all stay healthy. Cycle at home on an exercise bike. Go for a daily walk around the block. Park your car further away and walk. Do what you can without getting short of breath or overtired. You should be able to talk easily while doing physical activity.
Hey Chris.
How are you doing?
Here's your coffee.
Thank you. You're not looking too good today.
I've just had a rough past couple of days.
You know, with your heart failure, you need to look out for all the signs.
What are those again?
So increased shortness of breath, coughing, weight gain around your tummy and your ankles.
Oh, I'll be alright, hey?
The other ones are dizziness, worsening chest pain, palpitations, so your heart is racing. Let me take your pulse. Yeah, look, it is racing. I think we need to call an ambulance for you. Call your medical team if you have worsening shortness of breath, coughing at night, or swelling in your ankles or abdomen. Call an ambulance if you have worsening or new chest pain. Hey Craig, how's your health?
Pretty good. I've been working a lot lately.
You're a plumber, aren't you?
Yep.
You see this hose?
Yep, no water getting through.
No, this is what cigarettes are doing to your arteries. They're clogging them up.
So what's the solution?
Quit. Quit smoking. For help with quitting smoking, consult your medical team.
Hi, my name's Fiona Coote. About 30 years ago, I had 2 heart transplants, and in recent months, I've had a valve replacement. I've lived with heart failure, and I want to assure you that whilst initially it can be scary, life does go on, and you can learn to manage it. My attitude has always been to do whatever I can to assist my heart to function as well as it's able to. It's what we do every day that matters long term. But no one gets it right all the time, so don't be too hard on yourself. Staying well and healthy with heart failure requires you to follow the guidelines we've outlined. Thank you for watching this video.
Here is a list of 5 multiple choice questions. Circle the correct answer in the leaflet provided and send this back in the self-addressed envelope.